This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay. Well, thank you everyone for coming. I'm Nikola Dragojlovic, the program director at UT Health in Houston. I really appreciate you taking the time to join us and learn more about our program. Just to talk about UT Health. UT Health in Houston is the 9th largest medical school in the United States. And UT Health is based in the Texas Medical Center, which is the largest medical complex in the world. It is home to 4 academic hospital systems, of which we are one. There's 2 level 1 trauma centers. The Texas Medical Center has over 100,000 employees in healthcare, over 10,000 inpatient beds, and unprecedented access to diverse cases. People literally come from all over the world to the Texas Medical Center. And we have the privilege of serving patients for all of their rehabilitation needs through that. UT Health has over 1,500 faculty and over 1,200 residents and fellows in all their GME programs. So it's suffice to say, we are the largest GME system in the Texas Medical Center. We are affiliated with TIER, the Memorial Hermann Hospital System, MD Anderson Cancer Center, and Harris Health. Harris Health is Houston's safety net hospital system. And we are very proud that TIER and the Memorial Hermann Hospital System and MD Anderson Cancer Center are regulars on the U.S. News and World Report rankings. Our department at UT Health PM&R was actually founded in 1993, and we now have over 30 clinical and research faculty, and we staff TIER and other Memorial Hermann rehabilitation facilities. TIER's Neuro Recovery Research Center has over 10 faculty from UT and $24 million in research funding. We've been a part of TBI and SCI model systems for over 3 decades. We have a categorical 4-year ACGME accredited PM&R residency program, and we have fellowships in brain injury, spinal cord, and trauma amputee rehabilitation. So what sets us apart from other programs? Well, I think first and foremost, we're categorical and we're a small class size. We only take 4 residents a year. And when you go out on your rotations, you're working one-to-one with the attending physician. And that really helps you build close relationships with the faculty, but you also have close relationships with your classmates. You really get to know one another as you work through your training. As program director, one of the things that's most important to me is having the residents involved in the program leadership and development. So I'm regularly hosting town halls, having my chiefs involved in things that we do in the residency program to always keep our residency program moving forward and to keep everyone's training up to par and to have everyone be happy and enjoying their time with us. And I was a resident and a fellow at UT, and one of the things that Dr. Francisco, our chair, always talks about is the UT family. And that's something that's meant a lot to me personally and professionally during my time as a resident, fellow, faculty member, and now program director. And our alumni network is huge. And I've been able to build connections and network in great ways as a result of being a part of this organization. And that's something that you get access to and get to be a part of when you come train with us. You have excellent benefits and pay through the University of Texas. As a state of Texas employee, your resident pay, insurance benefits, there's a matching retirement program available to residents, along with really liberal leave policies for our residents. And Houston is an awesome city. It's a really affordable metropolitan area, tons of parks, museums, nightlife, restaurants, neighborhoods. Don't get me started about the culinary scene here. It's amazing. So a really good quality of life when you come here as a trainee or stay as a faculty member like I did. So this is our leadership team. Dr. Francisco is our department chair, well known in PM&R circles and one of my close mentors. Joel Frontera is our vice chair of education. That's me, the residency program director. I used to be a soccer coach back in the day. Dr. Joseph is our assistant program director, and Kathy Brown is our beloved coordinator. She is the one who really keeps us all together. She's really the glue that binds us. Our chief residents are Dr. Claudia Martinez, Dr. Vishal Bansal, and Dr. Morgan Cohen, who is our chief of wellness. They work really hard with me and the rest of our faculty and our residents to keep our program moving strong. They have strong presences on social media, so feel free to clue into them and learn a little bit more about our program along the way too. And we also have two social media liaisons, Dr. Ekachukwu and Dr. Martinez Santori from our PGY2 classes. They're helping us put together all the cool social media and Twitter content that our program does. So please be on the lookout for stuff coming through our Twitter and Insta as we gear up toward the application season. We're going to be trying to highlight the quality of life, things about our program, day-to-day life of the residents and stuff. So follow us and learn a little bit more. And I go back to that UT family and how important it is. We, as a small program, we really count on one another and we really support one another. And we are there to make sure that everyone else is successful. And we try to have some fun along the way too. So this is our commitment of support for trainees. We want all applicants to our program to know that Houston, as the most diverse city in the United States, and being in the Texas Medical Center really treats people from all different parts of the world. And our residents are an integral part of improving access to rehabilitation care for everyone who comes through our facilities. And our department wants to be a welcoming place for all. We want to make sure that our programs are vibrant professionally so that your ethical, personal, and professional development can flourish. I was talking a little bit earlier about our home in the Texas Medical Center. I'm talking about this a lot because it's such a cool place with 4 academic hospital systems, multiple medical schools. There's faculty, residents, fellows around every corner, and the level of care that patients receive is excellent. And the things that you will see as a physiatrist in training with us, I think, are unmatched in other residency programs. You can see the Texas Medical Center in the foreground. There's almost 40 buildings in the Texas Medical Center, and it is comparable in size to Houston's downtown, which is in the background over there. It really gives you some sense of scale and scope of what TMC really is and why it's such a cool and dynamic place to practice and train. On YouTube, there is an awesome drone fly-through of the Texas Medical Center. So screenshot this and watch this video later. Is a really cool introduction to all the different hospitals and facilities from a bird's point of view. So going over aspects of our curriculum, we have protected Thursday morning didactics and protected ground rounds for all of our residents and fellows. That means that you're not on clinical duty when you're in didactics. Our didactics are faculty-led, but residents also have opportunities to present very commonly through some of our other lecture series that we do during our didactics. There's also site-specific didactics. So when you're rotating at tier, there are Monday afternoon didactics, and at one of our electrodiagnostic sites, they do Tuesday afternoon didactics. So in addition to your Thursday didactics, you also get site-specific didactics. And we feed you breakfast and we give you parking. Of course, we want to make our didactics as interactive as possible. So we do regular workshops for physical examination and spasticity and procedural skills and P&O. And we want to make the didactics engaging and not something that you just sit down at and learn passively. We have a research course where you learn to be a good customer of the literature. And that's is a that culminates in a critical review competition with the UT and the Baylor College of Medicine PM&R residency program, where residents will pick a question, research it, and then give a presentation on the level of evidence and trying to answer that question. And that's a lot of fun. And a lot of people have turned those into manuscripts, posters, and publications. So a great way to get your research chops without having to commit to some large project. And then our parent organization, McGovern Medical School, offers some really fun additional programs for learning. They've got a physician educator certificate program. For those of you who are involved in teaching, you can learn a lot about adult learning and different teaching methods. And McGovern also offers a certificate in healthcare management. It's sort of like a mini MBA, something that our residents participate in a yearly basis. It's been really popular and a lot of fun. So we'll get you AAP, PM&R, AAP, and ISPRM memberships. We get you access to the AAP, PM&R board prep Q bank. As a PGY4 resident, you will attend Kessler's board review course. You get a yearly $250 book stipend and a yearly $1,250 travel conference attendance stipend. And we have 2 portable ultrasound machines for practice or educational use. Those are not used clinically, so those are for our residents to practice identifying all the contents of the tarsal tunnel and all of that good stuff. We have very generous leave policies at UT Health Houston. You get 3 weeks of paid vacation per year and up to 12 weeks available of FMLA that can be taken immediately upon your hiring. And we are committed to always supporting time away for any appointments that you need, whether that's personal or family related. Let's talk briefly about our rotation schedule. Because we're a categorical program, our internship is connected to the rest of our training, and that's done at Maine Memorial Hermann. You'll see you get about 4 months of wards, a month of ICU, and then the remainder of your time is on consults or floor services where you are doing things that are very PM&R relevant. And that sets the stage for your transition into PGY2, where it's predominantly inpatient, but we do some consult, MSK, electrodiagnostic rotations. And then as you transition into PGY3 and PGY4, you start getting into cancer rehab, more pain medicine, more sports medicine, additional EMG time. And then in your senior year, you have up to 4 months where you can select different rotations to really cater them to your learning needs. In terms of our primary rotation sites, TIER is sort of our mothership. It's a large freestanding inpatient rehab hospital in the Texas Medical Center, about 130 beds, where our PM&R residents rotate through in both inpatient and outpatient clinics, and sort of like the flagship rehabilitation hospital in Houston. Memorial Hermann Texas Medical Center is the academic affiliate of the McGovern Medical School. It's home to the largest level 1 trauma center in the country. There's over 1,000 beds at this hospital. It's where LifeFlight started some 30 years ago. It's a certified stroke center, multiple organ transplant service lines, busy heart and vascular surgical services. And we have a busy consult service there, as well as a 16-bed inpatient rehab unit there. So suffice to say, lots of learning in a hospital where PM&R has a really big presence. MD Anderson Cancer Center is where we have our cancer rehab and some of our pain medicine rotations. MD Anderson is a mecca for cancer care and a great place to learn cancer physiatry. They have one of the largest groups of cancer physiatrists in the country. And so we're really happy that our residents get to rotate there and do research there and be part of all kinds of things that institution is known for. And then the Lyndon B. Johnson Hospital is part of the Harris Health System, and Harris Health is Houston's safety net hospital system. It's the busiest level 3 trauma center in Texas, and it serves the Northeast Houston area. PM&R has a consult service there, along with one of our additional electrodiagnostics clinic, and my favorite rotation, which is a PM&R ortho surgery outpatient MSK clinic, where PM&R and ortho literally work side by side to manage patients with musculoskeletal and electrodiagnostic needs. So in terms of where our graduates go, you'll see that they go all over the place. within physiatry, obviously pain medicine has been really popular over the last 5 years, and we've been really successful in our residents matching excellent pain fellowships like UC Davis, University of Colorado, University of Utah, MD Anderson. But we also have had graduates who go into spinal cord injury or brain injury medicine at Shirley Ryan or Harvard Spalding. We've had some residents go into private practice, and we've had some residents stay on as faculty. And, it's a real mix. And the one thing I can say is that, coming to our program, regardless of your interests, I, as program director, will do everything I can to make sure you are successful and you get the training and experiences you need to take that next step after graduation. So in terms of program updates, everyone wants to know what's coming down the pipeline for our program. So we've got a cool new sports medicine rotation with the UT Health Family Medicine Sports Medicine Fellowship. They do lots of coverage with some of the local high schools and universities, and that's going to be a lot of fun. UT Health and TIER are doing the first osseous integration program for limb loss patients, and we're really excited about that gearing up. So our residents are going to be a part of that and those clinical trials that are going to be going on at TIER. Our prosthetics and orthotic rotation that was developed 2 years ago has been a big success. And we're adding on wound care learning experiences from UT Health Houston's cardiovascular medicine department as wound care becomes a bigger part of things that physiatrists are doing. That's such a cool and interesting learning opportunity and really melds well with the care of people following limb loss. And our department is developing a pain program in conjunction with ortho and anesthesia. So as that program builds, our residents' exposure to spinal procedures continues to grow. So be sure to check us out on Twitter or X, whatever you want to call it, and Instagram as well. You can also check out our website. We are striving really hard to keep that website updated in real time with information about our recruitment processes, interviews, and the like. So check our social media presence or our website for things of that nature. Or you can always email or call our program coordinator, Kathy Brown. Her email is there, but also available on our website. So thank you so much for your attention, and I'm very happy to answer any questions people have. Yes, Monica Verduzco-Gutierrez says we're not calling it X. Okay. Someone asked me what makes the PM&R specialty special to, and then it got cut off. So to me, what makes PM&R special to me? Wow, that's a really deep question for this platform. But I would say the fact that we get to impact people's day-to-day life on a daily basis. We give life back to years. And I think that is the most important thing to me as a brain injury medicine physician, and something that I think all of our faculty take seriously. Robert MS says, for the new sports medicine rotation, what local universities will you be collaborating with and how long is the rotation? So it's currently in a pilot with our PGY4s, working with University of Houston and local high schools in the Houston area and the University of St. Thomas. So if the pilot works out really well, we hope to expand it to our other residents. But the first pilot year is with just our PGY4s. Is there a dedicated research track or rotation time for research projects? There is protected research time available. Yes, it all depends upon how much time you need and how involved you are in research. We've had residents who have done a lot of research and not needed time. And just last week, one of our residents had their IRB approved for a new study in spinal cord injury and ventilator management, and she got protected time twice a month for that research protocol that she's involved in. And so I think it really depends upon your involvement in research, but we have mechanisms to support your participation in research, definitely. Are all the rotations in the residency within the Texas Medical Center? If not, how far are the other rotations? So the overwhelming majority of the rotations are in TMC. The others, the furthest drive you would go would be about 30 minutes. So Houston is a city where you have to have a car. For the most part, there are ways to live in Houston and not rely on a car very much, especially if you live along the train lines and travel into the Texas Medical Center that way. But for the most part, you need a car to get around Houston. And so 30 minutes or less is the furthest you would need to go. For the musculoskeletal physical exam. Very confident. Were any of the upcoming updates a result of resident feedback? Yes, they were. The wound care addition to the prosthetics and orthotics rotation literally came from our graduating PGY4s who felt like they didn't quite get enough of that. And as they were transitioning to caring for patients with limb loss, they felt like they didn't understand the wound care principles well enough. Same with the sports medicine rotation. We have lots of residents who are interested in musculoskeletal and pain management, always trying to get more ultrasound guided procedures done. And so collaborating with the UT Health Family Medicine Sports Medicine Fellowship was like a natural go-to for us. So they started getting involved in their didactics and doing sideline coverage with them. And so those two things that we've done in the last academic year came directly out of resident feedback. Are residents involved in any community outreach or volunteer activities? Yes, a lot of them. One of the cool things about Houston is that it is home to a lot of different civic organizations with all different types of goals. I know residents that participate in adaptive sports in one form or another. I know residents who volunteer with RSVP, which is a large organization, a national organization with a Houston branch that does durable medical equipment and physiatry care for underserved populations, and all kinds of volunteer things in between. So literally pick your sport, pick your civic organization, pick your religious or cultural group, and go to town. Houston is like the most diverse city in the United States and is well represented with civic and cultural volunteer organizations. Are didactics done virtually for other med students and applicants to attend? So our didactics are in person, but visiting medical students can attend our didactics and grand rounds, but unfortunately they're not open to the public. Is that my 2-minute warning, Renato?
Yeah, no, thank you so much, Dr. Dragolovic.
Tried to cram it all in there. Thanks everyone for your attention.
Please feel free if you have any additional questions. Utilize the chat, Dr. Dragolovic, if you'd like, please, if you'd like to field questions in the chat. Otherwise, thank you so much.